Hello, I'm Connor Clavino, one of the orthopedic trauma surgeons at Harborview Medical Center, Associate Professor of Orthopedic Surgery in the Department of Orthopedics and Sports Medicine. I'm here today with one of our residents, Dr. Avery Novak, and we're discussing our recent manuscript regarding the fallacy of follow-up in orthopedic trauma. I think the genesis of this project was over the decades and years of evaluating patients and attempting to publish research projects and manuscript. We continue to run into the challenge of the expectation of minimum 1 and 2 year follow-up for journals, and we kind of motivated us to take a look at what our actual follow-up rates in our clinical practice.
I think the findings that were most notable for us were that in general we had less than 30% follow-up rate of 1 year for all patients within our cohort. And then in addition, we had 20% of our patients that actually completed their clinical care and would advise that they didn't need any further follow-up prior to that 1 year time point.
I think that also brought to the surface for us in our minds is the clarification of what is the question we're asking. If the question of outcome is, did the fracture heal? Well, most of those outcomes are known within the first 6 months. If the question is, did the patient go on to have post-traumatic arthritis after a periarticular injury? Well, clearly that's not known for years and perhaps decades afterwards. The very common question of how is the patient doing or patient outcomes, well, that also can evolve over time and change over time. So I think really understanding what time point are you going after, having that relate to what question you're asking, I think is important.
I don't think we're advocating that practitioners change their practice based on this. I think continuing to be intentional when we're asking patients to follow up. And I think we're asking that journal reviewers are also considering what the realistic expectations are and what's clinically relevant for the question that's being asked for the research project should be in terms of follow-up.
I agree, Avery. I think that when we look at what we're actually providing for the patients over time, as treatments have changed, so has our clinical follow-up changed. And so if we are not following them up for any specific clinical reason, then it shouldn't also be an expectation for research.
I think we're also kind of looking to the future and how new paradigms and new technology that we have, including web-based interfaces, tablet-based interfaces, are going to kind of change practice and how we follow up patients, and that may affect in the future the duration of follow-up and the kind of interactions that we have with our patients in answering these questions.
Thank you.